Africa's top public health body, the Africa Centers for Disease Control and Prevention, has declared the continent's monkeypox outbreak a public health emergency. Africa's CDC Director-General Dr. Kaseya says the declaration will help countries and organizations mobilize resources to tackle the outbreak. CGTN's Wikisser Nabaya has more.
4 months after scientists reported a new strain of the mpox virus in the DRC, the Africa Centers for Disease Control and Prevention now says the mpox outbreak constitutes a public health emergency of continental concern.
With a heavy heart, but with an unyielding commitment to our people, to our African citizens, we declare mpox as public health emergency of continental security in Africa.
In recent weeks, health experts have expressed concern as the new and more deadly strain of the mpox virus spread from the DRC to 15 other countries. Burundi, Kenya, Rwanda and Uganda are among the countries that have reported mpox cases for the first time. According to Africa CDC data, there have been over 17,500 cases of infections of mpox and more than 500 deaths on the continent this year. Experts say this calls for regional solidarity in tackling the disease.
The information we have reflects only a partial situation of what's actually happening. So that means that even though the situation and the evidence we had showed that the problem was quite severe, it's in reality probably even more so given the limitations we have.
The declaration is a call to leaders to make resources available to help fight the outbreak. The continent's top public health body says Africa needs 10 million mpox vaccine doses, but currently has access to just 200,000.
Mpox is a global threat, a menace that knows no boundaries, no race, no creed. It is a virus that exploits our vulnerabilities, preying on our weakest point. And it is in this moment of vulnerability that we must find our greatest strength and demonstrate that we are all learning from the COVID lesson, and we are playing solidarity.
The development comes ahead of a meeting by independent experts appointed by the World Health Organization to decide whether the mpox outbreak in Africa is a global public health emergency. The committee will advise the WHO Director-General on what recommendations he should issue to manage the spread of the disease. Vulkisa Nyabwa, CGTN.